Hello everyone and welcome back to another insightful episode of MedSynapse podcast series where we explore medical experts and their discussions. I'm your host Hetvi Shah, and today we're exploring one of the most exciting frontiers in medicine, which is genomics, and how it is reshaping the way we diagnose and treat patients in the real world. And to help us understand this transformation, I'm joined by Dr. Nikhil Ganjoo, a renowned pediatrician who has been at the forefront of integrating genomic insights into clinical practice. With extensive experience in managing complex pediatric conditions, Dr. Nikhil brings a wealth of real-world perspective on how genomic medicine is changing patient outcomes. So he's the perfect guest for this discussion. So, Doctor, it is such a pleasure to have you with us today.
Thank you for inviting me, and I'm so glad that you share the same passion as me about genomic medicine.
Yeah, Doctor. So, it's so wonderful to hear that. And let's just dive straight into the topic today. So, could you begin by sharing a memorable case where genomic testing completely altered your initial clinical diagnosis or management plan? And what was the turning point in that case, actually?
I think as a pediatrician, there are many cases that I can think of, but the most significant case that sticks in my mind to date is a case where a 4-month-old child was sent to my clinic for faltering growth. That means they were not growing adequately. During my initial examination, the most obvious thing was that the shape of the head was small, the size was plotting small, and apart from that, the child was significantly weak. Hypotonic, as we call it. So pre-genomic medicine, we would do the metabolic screen, look for metabolic causes, get an MRI done, which I had progressed with, and the MRI was quite significant. It showed hypomyelination. That means the brain development wasn't good enough. It wasn't up to what we were expecting at that age. So pre-genomic medicine, I would have thought maybe it's a neurological condition which needed further investigation. And what would normally happen, what naturally happen is the child would have a repeat MRI at 1 year of age to see is it something that's progressively worse or is it something that's getting better. However, with the advent of genomic medicine, since I've done a qualification in that, I had access to the data scientists, I sent some special whole genomics testing for this child, and within 2 weeks I had a very interested lab scientist calling me back mentioning that they had found a disease causing variant, a mutation in the gene which was quite significant. But the catch to this situation was there were only 4 reported cases in the world, and all of them had a significant renal failure, a kidney failure, which was not the case in this child. So when we battled this through, this was 11 o'clock at night, when we went through the whole scenario, we realized that the 4 cases, the kidney failure started at 1 year and after 1 year of age. Whereas this child was picked up early because of some other problem, which is another thing which comes with the condition. So then started the genetic counseling for the family, saying that we have found a significant mutation which usually presents with kidney failure, which is resistant to steroid. And unfortunately, you have a short lifespan. They don't live past 2 years of age. So why this is an important case is because we had an early diagnosis well before anybody else could have picked it up, which meant that we had time to counsel the family. We could put in place testing to look out for renal failure, kidney failure. So we could catch it early, have specialists in place, and that prepared the family for what was going to be the progression of the condition. So unfortunately, we had to share this damning diagnosis with the family, but what helped them, and I'm still in touch with the family, is that they could prepare themselves for what was lying ahead. And this is the magic, this is the power of genomic medicine, that we caught the diagnosis well before the problem started. We could put things in place, we could put surveillance in place so that we could help the family and the child well before they went into renal failure. That's kidney failure.
Yeah, that's like fascinating, and it's so also saddening also. And actually it really highlights how genomic testing can turn, uncertainty into clarity, especially in such complex cases. So now, doctor, in your experience, what clinical scenarios have benefited the most from genomic insights? For instance, oncology, rare diseases, or pharmacogenomics. So could you walk us through a real example there?
So, as I said, I'm a pediatrician, but we deal with other colleagues, we speak to them, and we know the power of genomic medicine. So, talking through diagnostics, finding a mutation which is pathogenic, which is disease causing, and then thinking about precision medicine where we can target the treatment to an individual. So it's important to understand what is genomic medicine. So if you think of a human being having an instruction manual, the instruction manual gives the body cells their power to grow and to progress ahead. So if there's something wrong with the instruction manual, if there's a misspelling in the instruction manual, what will happen is either you can get cancer producing cells or you can produce abnormal proteins which give you rare conditions. So breaking down genomic medicine and its use clinically, it's in two broad categories. One is to support oncology, which is cancer, and the other is to support rare conditions. So the example I've shared previously is a rare condition. As I said, there are only 4 reported cases in the world. And thinking about it, possibly there are much more cases of that disease which are not picked up because genomic medicine is still an evolving field and not available to everybody. So the child may die of an unknown kidney problem which is not diagnosed because they don't have access to the genomic medicine. Now, thinking about oncology, because that was your question, I'll take one example from pediatrics and one from adult medicine. So pediatrics, a common blood cancer is ALL. So that's a kind of common cancer which is seen, a blood cancer which is seen in children. There's some forms of it where we've got something called Philadelphia chromosome. If they have that abnormality, the fusion of the mutations which are seen on the chromosome, what we know is the box standard, one size fits it all treatment is not as effective. So if we can get the genomic testing to get an early answer to see if the mutation is there or not, we can tailor the treatment for the child, which is effective and which is targeted. It's precision, it's individual based. Now thinking about an example from oncology, from cancers in adults. So we know there's a condition where there's an evolving pre-cancer called MGUS. That's you get the M band, the proteins in the person, and that can evolve into one cancer or the other. So you can do a panel for that, panel genomic testing, and depending on the mutation which you get. So if you get a MYD mutation over there, you know that will progress to a Waldenstrom's macroglobulinemia versus a multiple myeloma. So people can prepare as the condition worsens to know which direction to go in and how to target the chemotherapy. So that is the power of predicting which direction it's likely to go in and prepare for the chemotherapy based on that case.
Wow, that's like a great point, and you can, bridge the gap also between these things. So, sometimes genomics reveals findings that contradict conventional diagnostic impressions. So, how do you balance such genomic data against, clinical judgments and imaging or pathology results?
So again, if you reflect back to the first case I discussed, when we had that genomic diagnosis, everybody was flustered in the laboratory because the information I had given them didn't fit in with the diagnosis, but what is widely known is that mutation causes that condition. So answering your question, the key is multidisciplinary approach. It's not just the clinician sitting there or the laboratory staff sitting there. You have to share that information. You have to share the phenotype, the presentation of what you see. And then it also involves engaging with the family, seeing how the case involves. Very often we get the geneticist also on board, because whenever you set a sample for genomic testing, there are a few things you need to be aware of. What can come out of the results? One is that you can find a mutation which is known in our worldwide database to cause a disease. So that's the pathogenic mutation that we find. Another thing is that you find a benign mutation. That means it does not cause any condition, and we know it's a safe thing. So it's possibly a misspelling which is not leading to a protein being produced, which causes a problem. The third thing we have is VUS, variants of unknown significance. Those are the is it there, is it not there variants. So that means it is not at present known to cause any pathogenic condition. So it's not disease causing. However, as the data evolves, somewhere in the future, it may be linked as we get more and more information into our database. And the fourth thing is everything's fine, there's no significant mutation. So it's working together, seeing if it tallies up with the biochemical findings that you have, and if it's fitting in with the radiological findings. So again, going back to the first case, as I said, we had the MRI for the child, which didn't fit in at that point in time. But as the case evolved, it was very typical of that case. And how it helped that child was, if we didn't have the genetic diagnosis, that child would have to be put under general anesthesia at 1 year of age to have another MRI. But since we had that diagnosis, we didn't need to do that because we knew what was causing the brain changes, and that helped with the child. So whenever there's a doubt, it's good to sit down together, have a multidisciplinary approach, and see how to progress. The commonest problem people face is in cardiology. So in cardiology, where they have problems with the heart, you can do all these panels to see if there's a familial cause for these. And very often they get variants of unknown significance, or they get a pathogenic mutation, but the person is really, really well. So very often what happens is you don't do a single person, the patient's whole genome sequences, you do a trio. So that means you do the whole genome sequencing for the patient and for the mother and father, because that's where the genetic material has come from. And if you find that the same variant a mutation is present in the parents who are asymptomatic, then you can let your guard down and you can relax a little bit. Whereas if they're affected and they have the same mutation, then you know it's kind of linked in the family.
Yeah, absolutely. I think the multidisciplinary approach is very much needed in any specialty, and I think the balance is also really important. So now looking beyond diagnosis, genomics has redefined treatment as well. So can you share a case where targeted therapy guided by a genomic mutation significantly changed patient outcomes?
So, as I said, I'm a pediatrician. My other interest is neonatology. And what we find in neonatology is that whenever a child is thought to be septic, that means they're unwell and they need antibiotics, we give them intravenous antibiotics, IV antibiotics. And the commonest infection is group B streptococcal infection, which is inherited from the mother. So internationally, it's recognized that benzyl penicillin and gentamicin are the drugs of choice. Now, what we know is gentamicin is known to cause ototoxicity. That means toxicity to the ear, which could lead to irreversible damage to the hearing. What we know is a certain percentage of the population have a gene mutation where they can't process that gentamicin through the system well, leading to a higher risk for them having hearing loss. Now, how the genetic testing has revolutionized treatment is that instead of doing the general treatment for everybody with the 2 antibiotics, you can get rapid turnaround to check for this genetic mutation. And there's some machines where you can do a quick point of care testing. That means you can get quick, rapid results. So while you're getting the cannula in, getting the baby sorted, and before you start the antibiotics, you can get a result saying that the gene mutation is there or not. And if the child has the gene mutation, you just alter the antibiotic which you would normally give for the child. So that's groundbreaking because you're preventing irreversible hearing loss, and you're tailor making the treatment based on a mutation which may or may not be present.
That's so truly inspiring to hear. Also, like a perfect example of precision medicine in action, where identifying a single mutation actually can change the whole treatment only.
Thinking about oncology, so we've got high-grade gliomas, tumors in the brain, and depending on the mutation that you see, you can tailor make the chemotherapy so that it's targeted, it's specific, and with good outcomes. So instead of doing a blanket chemotherapy and hoping that it works, you from the onset of the chemotherapy know that you're targeting for an ideal outcome in that patient, giving them the best chance for remission.
That's really inspiring to hear also. So now, doctor, the incidental finding from whole exome or genome sequencing can complicate decision making. So how do you approach discussing these unexpected results with patients and care teams?
So again, it's a stepwise process. A patient should know and willingly consent for the genetic testing, because there are aspects of the results which they may be not expecting at all. So the counseling is very important. In the UK, you cannot order the whole genomic sequence testing unless you have had the counseling sessions which you've done online and you've understood how to counsel the families. You have to consent on a form saying that you've done the counseling and you've consented for the testing, where you're telling them that there may be unexpected results which may have a future impact. So you're checking for one thing and something else may crop up in the whole genome in testing. Now, the next part is when you have these results, you have to then speak to the family, be open and honest, and say that these are the findings. And most of the genomic reports will say if it's a pathogenic variant, that means it's a disease-causing variant, or it's just a benign one, or it's something that's in the middle, that's the VUS, which over a period of time we can revisit. If it's a pathogenic variant, you often have to refer them to the geneticist to see what impact it is likely to have. Because if they have the mutation, it does not mean that they'll get the disease then and there. It may be something that evolves with time. And that's where the difficulty comes. Now, the other caveat to all of this is the insurance. Because if you know you've got a disease-causing variant, it may have an impact for insurance. Every country deals with it differently. In most European countries and in America, you do not, as a clinician, have to declare the variant to the insurance company. It's up to the individual to declare that their own kind of judge and at their own judgment. But that's a whole minefield in itself. And as this field develops further, as we do more genomic testing, as we have more diagnosis coming through where the person is not affected but is likely to have a condition later on, that'll open up another can of worms.
Yeah, I think that's such an important aspect also. And also I feel in such cases, communication and counseling are often as critical, I would say. What are your thoughts on that?
And there's another important thing. So in America, in the Rady Children's Hospital, they've started the newborn genomic testing. So they take some blood sample from a newborn baby to look for various kind of conditions which they may have, which is good to know if they have those conditions previously. So I'm currently in the UAE. The Abu Dhabi government has also implemented the newborn genomic testing, and the hospital where I work in Dubai at the moment, it is not a mandatory thing, but it's an optional test that some parents can opt for. So again, it needs a lot of counseling because the easiest thing for us to do is order the test, take the blood sample, but it's the family who need to then live with the results and live with the implications of the results that may come forward. And some families do opt for it because they want to be prepared for whatever lies ahead. And it's like opening a book and reading the pages and knowing how the story unfolds.
Yeah, that's really interesting to know. So now, doctor, finally implementing genomics in routine practice can be very challenging to be practical. So from cost to interpretation. So what practical strategies or system level changes do you think can make genomic medicine more accessible in real world clinical settings?
That's an excellent question because I've trained in the UK and they recognized very early on that this is the way forward. So Genomics UK has implemented the Genomic training program because you're as good as the training you receive and the knowledge you impart to your patient is as good as what you learn yourself. So as part of that recognition that this is the future, there are lots of universities who have an accredited program offering masters in genomic sequencing or genomic analysis, genomic medicine. So they're empowering clinicians like us who deal with these very often. I said I was a pediatrician and a neonatologist in the UK. So very often we were doing antenatal counseling for families. So thinking back to a case where a family had a child who died within the first month of life, post-mortem, they recognized a genetic mutation which caused very significant renal failure, which the child succumbed to. So going forward, they were offered pre-implantation genomic testing via IVF, which they declined. But when the child was born, we could immediately send for looking for that mutation, where then we could direct the care of the second child based on the mutation they had. So that can only be possible, firstly, if the clinician is empowered, they understand what genomic medicine is. Second thing is having genetic counselors, geneticists who are on board, who can then counsel the families. And number 3 is raising awareness. So as I said, we've implemented the newborn genomic whole genome testing, where we're testing for over 200, 300 conditions on just a blood test. So it's empowering, spreading the knowledge, spreading the awareness like you're doing through this webinar, which raises the awareness. So I would hope that there are clinicians, there are people in the general public who listen to this webinar and think, this is something I didn't know about. I didn't know about the power of genomic medicine. Let's study more. Let's understand this more. And they feel enthusiastic about the subject. Spread the knowledge, maybe gain some knowledge and understanding of what this has to offer. So it's a stepwise process, empowering the clinicians to understand it through education. Number 2 is spreading the word, which you're doing. And number 3 is working together to understand this better, to implement this better, and to take this forward, because the only way is up, the only way is progress ahead. And the more knowledge we get, the more testing we get, the more data we collect in these worldwide databases, where then the variants of unknown significance either go one way or the other. They become a benign variant or they become a pathogenic one.
Yeah, absolutely. All those 3 pointers are really encouraging to see, how these system level efforts are gradually making and will make genomic insights part of everyday medicine. So thank you so much, doctor, for sharing that. And it has been such an insightful conversation throughout. And I have also learned so much about genomic medicine today. So it's really interesting to know.
Thank you again for the invite. And I hope that people listen to this and continue to gain further interest in genomic medicine.
Definitely. And thank you for joining us and sharing your perspective on genomic medicines with our audience. And I'm sure they'll gain a lot from this conversation today. And to our audience of healthcare professionals who is eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource. It's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, take care and keep learning.